Thank you, Mr. Chair. I rise to urge all colleagues to support this amendment, which would provide for additional funding reductions for NIH. If we've learned nothing else from the executive branch's involvement and handling of the COVID-19 pandemic, at the very least, we learned just how corrupt and money-hungry the NIH as an organization truly is. It has been over 3.5 years since the initial COVID lockdowns, and the NIH continues to cover up and downplay its gain-of-function research at the Wuhan Institute of Virology. Earlier this year, the Inspector General's report found that between 2014 and 2021, the NIH did not adequately follow its policies with respect to three grants totaling about $8 million to the EcoHealth Alliance. And the EcoHealth Alliance had a relationship with the Wuhan Institute of Virology in which it sub-awarded $600,000 to research coronaviruses in the years leading up to the COVID-19 pandemic. NIH terminated the EcoHealth grant in April of 2020, then later reinstated it, only to suspend it again after setting conditions for resumption. The EcoHealth claimed it could not meet. The NIH permanently terminated the award in August 2022 for compliance issues, including the Wuhan Institute of Virology's failure to provide NIH with laboratory notebooks related to the funded experiments. But then again, in May of this year, the NIH reinstated grants to renew its, quote, collaborative research to understand the risk of bat coronavirus spillover emergence, end quote. Seriously? In addition, late last year, the NIH issued a new grant to EcoHealth Alliance for a project titled Analyzing the Potential for Future Bat Coronavirus Emergency in Myanmar, Laos, and Vietnam. The grant provides EcoHealth Alliance with $653,392 covering a period until August 31st, 2027. Why is an organization that failed to comply with reporting requirements continuing to receive more and more American tax dollars? Even more disturbing, earlier this year, the acting director of NIH, Dr. Tabak, testified before the House Appropriations Committee. I asked him whether gain-of-function research was conducted at the Wuhan Institute of Virology, and he responded, no. However, in an October 20th, 2021 letter to then Oversight and Reform Committee ranking member James Comer, the NIH admitted to funding gain-of-function research on bat coronaviruses at the WIV. Ironically, Mr. Tabak authored this letter in which he stated that the, quote, limited experiment tested whether, quote, spike proteins from naturally occurring bat coronaviruses circulated in China were capable of binding to the human ACE2 receptor in a mouse model. This is classic gain of function, and this is unacceptable. Americans deserve to know the truth, especially when their tax dollars are funding these dangerous practices. As if that were not enough evidence to justify a budget cut, the Biden administration has also inappropriately used the NIH as an extension of the president's radical, unethical policies. For instance, in April of 2021, the NIH reversed restrictions governing federal-funded research to allow the use of fetal tissue obtained from elective abortions. I am grateful the underlying bill includes several guardrails for fiscal year 24, such as prohibiting funding for unethical human embryo and aborted fetal tissue research, prohibiting any support to the Wuhan Institute of Virology, and prohibiting gain-of-function research in an adversarial country. These are good provisions, but they are simply not enough. I also recognize that the underlying bill has reduced the NIH's funding by about 12.5%, but I strongly believe a larger cut is warranted if we want the NIH to realign its priorities with congressional intent. Not only would a larger budget cut force the NIH to eliminate irresponsible spending and research, but it would also send a strong message to the Biden administration that Congress does not approve the NIH's actions. Mr. Chair, my time has expired.
Gentlewoman's time has expired. For what purpose does the gentlewoman from Connecticut seek recognition?
I rise to claim time in opposition to the amendment.
Gentlewoman is recognized.
Okay. I guess I'm having trouble listening to a series of science deniers here this afternoon. That's really troubling. The amendment would cut funding to the National Institutes of Health by an additional $3.6 billion. The base bill already cuts NIH by $2.8 billion below what we are talking about in 2023, the 2023 numbers. So 2.8, another 3.6. I think there was another amendment that took additional money, which means that this amendment would bring the overall funding cut to the NIH of $6.4 billion at current funding levels. That would mean drastic cuts to life-saving research on cancer, on Alzheimer's disease, on ALS, on diabetes, on infectious diseases, and the list goes on and on and on. This amendment would cut funding to the National Cancer Institute by an additional $710 million. I'm a survivor, a 36-year survivor of ovarian cancer. I had the benefit of biomedical research. Why shouldn't other women have the benefit of biomedical research to save their lives, with ovarian cancer being one of the biggest killers of women in the nation? It would also cut funding to the National Institute of Child Health and Human Development by $175 million. It would cut funding to the National Institute on Aging by $441 million. Let's tell that to all of our elder Americans and the issues that they have as they age. And let's cut back that research. It would cut funding to the National Institute on Drug Abuse by $166 million. I continue to hear from my colleagues on the other side of the aisle about how upset they are about addiction and drug abuse and the increase of that, and what are we doing about it? Well, this research addresses that issue. And it would cut funding to the National Institute of Mental Health by $200 million. Do we not understand that we had a crisis in mental health in this country before the pandemic? And we are in a serious crisis with mental health at all ages post-pandemic. And we want to cut the money for the research for mental health? Put simply, this amendment would mean a drastic cut to scientific breakthroughs, cures to diseases, and life-saving treatments. Do you know that the United States has been the leader in the world? We have in health and advancement. We have the NIH, we have the CDC, we have the FDA. These are crown jewels in what the health is about in the United States and the cures here and abroad. Why would we want to roll back our advancements in health, science, and medical achievements? This does go backwards. I end, which I've said on it in prior amendments. Our job with these bills is to save lives, not to be engaged in political diatribes. I yield back.
Gentlewoman yields back.